Hello, everyone, and welcome to a new session with Rights and Responsibilities Awareness Initiative. Today, we are lucky to have Ernest Johnson, a mental health expert, and he will kindly talk to us about ADHD. Ernest, thank you so much for being here with us today.
Hello, thank you for having me. I am very much committed to talking about issues related to mental health and individuals' well-being, and I'm very happy to have these discussions. I'm passionate about these issues, so it's an honor to be here, to be honest with you.
Thank you, sir. So, about ADHD,
Yes.
what we can talk about it. The floor is yours.
All right. So ADHD is a um, relatively common neurodivergency, which I think that there is a want to cast neurodivergencies as a problem necessarily. And I think a more accurate way to discuss neurodivergencies is to discuss them is as terms of just being different in terms of brain function. And the analogy I often make is it's kind of like being left-handed. Um, Left-handed people use a different hand. And for a long time in the West, left-handedness was thought of as a deviancy that was to be disciplined out of children. And there's a lot of analogs about that and ADHD. And the simple truth is people who are left-handed and people with ADHD function slightly differently and have different needs and different capacities, different strengths and weaknesses than people who are neurotypical. And it is important to frame things in that way. Um, the the want again is to pathologize or treat it like a disorder when in fact it is it's just a difference in being. And Eastern views and some Eastern views and some indigenous views hold it as a gift for the fact that it's a difference that lends itself to a different perspective and is helpful to the wider community. So ADHD itself is a long-term condition that affects children and adults, and there's different times of being diagnosed. Adult diagnosis looks a little bit different than childhood diagnosis. And the short of it is children and adults with ADHD have difficulty paying attention in most cases, and they have difficulty with being impulsive and being hyperactive. And we'll get to some of the strengths later in a discussion, but that is the short gist of things. And both adults and children with ADHD can be impacted by low self-esteem, troubling relationships, and often poor academic performance or poor work performance in some contexts. And it's a matter of having individuals with ADHD get the tools they need and get the supports they need in order to be successful, not because of any weakness or pathology of their condition, but rather because the needs are different. So there's a few different things that define ADHD in terms of symptoms. And to be clear, there are um, there are like with anything online or anything in relatively casual conversation, one can diagnose themselves with just about everything. So keep that in mind. Amateur diagnostics is a slippery slope. I forget the exact terminology of the saying, but if you Google a health problem, all roads lead to cancer. And I would caution anyone who hears this discussion, Google some symptoms and like, aha, I have ADHD. Please involve a professional in order to make sure the diagnosis and prognosis is accurate or trending towards accuracy. So there are three major types of ADHD. There is predominantly inattentive, and most of the symptoms in this case fall under inattention, focusing and staying on task, also organizational problems. Then there's hyperactive and impulsive type ADHD. And most of the symptoms in this case involve people being highly hyperactive and highly impulsive, too much energy, essentially. This can manifest in disruptive behaviors or kind of blurting out in conversation and acting prior to thinking of the the effects of the behavior. And then there's the most common type is the combined type, which combines symptoms of both. Individuals can meet the criteria for both, and they'd have the combined type. So Inattentive symptoms, um, a lack of paying attention to close details and falling behind on work tasks or school tasks, trouble staying focused in tasks or social activities, um, trouble listening even when spoken to directly, having a hard time following through on instructions and not finishing tasks or what have you, organizational struggles, staying away from task avoidance. That's a big one. Anything that requires mental focus, people can be something that people with ADHD will struggle with engage starting. And it's kind of general procrastination, sorry, but it is born of the anxiety of the arduousness of the task of staying focused enough to complete whatever task. Um, and then losing kind of relatively minute items needed for tasks, such as, you have a written exam and in university, let's say, and you forget to bring a number two pencil, a pretty obvious thing that is relatively small. Um, Easily distracted and thoughts kind of become focused on something else rather than staying on task. And then forgetting relatively day-to-day activities, like, and then an inability to engage with them, like, did I brush my teeth this morning? It's a relatively routine task, and people with ADHD and attentive type are going to be all the more prone to um, not remembering if they did. And then hyperactive symptoms include constant fidgeting and squirming and movement when needing to sit still, having a hard time staying seated when doing work or academic tasks, um, always being physically needing to move and on the go, and inappropriate physical movement, such as standing up and doing jumping jacks in a meeting. I mean, that's kind of our, you know, a little bit of an extreme example, but that could be a feature. Having trouble being quiet, having need to talk too much, having a need to also blurt out and interrupting narratives because sitting on the thought that you have in your head is as someone with ADHD is very, very challenging. Having trouble waiting your turn and then interrupting others, kind of the flow or the narrative of conversation or social interaction to kind of burst forward with your own. And this can lead to problems with social interactions. And it's not that um, it's not that people with ADHD necessarily want to have terse interactions. It's just harder. Neurodivergence, a commonality with all neurodivergence is more difficulty in social interaction. Now, the causes of ADHD are simply not clear. There is, I must add, right now in the kind of the cultural zeitgeist of the West, because of actions of certain people in an administration that I shall not name, that I am not a fan of, have put it out in kind of the popular discourse that neurodivergence is a pathology and that there are very finite causes related to vaccines or related to fluoride or related to whatever stimulus. And the truth is, those are very false narratives that have been disproven many times. And I am concerned for individuals with ADHD that these narratives are being put out there, and concerned for the wider population as well. With that said, the cause is not really known. Risk factors, a blood relative, parent, sibling, or another close relative has ADHD or another form of neurodivergence, such as autism or ASD. Some environmental toxins, in particular lead, do have a relationship with ADHD. Now, lead was relatively common. Leaded gasoline was common until I think the 90s or late 80s, depending on where you were. Lead in paints was very common, I believe, until the 70s. So there's exposure at certain times of life that may cause ADHD-like features. Born to a parent who used recreational drugs and or alcohol or tobacco during pregnancy. To be clear, there's a lot of health problems related to that as well, so that's not necessarily a given. And then premature birth also has a relationship with ADHD, as well as low birth rate, but that's tied to substance use and premature birth as well. Um, so another myth is sugar causes ADHD, and there's no tangible information to suggest that. In fact, studies suggest there's no correlation whatsoever. Now, people with ADHD have some complications. Those can be related to trouble in academic or work environments, failing to complete tasks. People with ADHD tend to have more physical accidents, be it shutting your finger in a door, or falling down a flight of stairs. People with ADHD are much more likely to have those type of accidents. Um, Social difficulties, because social engagement is very, very different. Um, and then being accepted by peers is more difficult. Um, People with neurodivergence have a higher rate of alcohol and drug misuse and abuse than the general population. And because of that, there's also a greater likelihood that one is going to be involved with legal ramifications as well. People with ADHD tend to have um, a higher risk of suicide in general and more likely to engage with suicidal ideation. Ideation being thoughts of suicide that don't necessarily lead to suicidal actions. And then sleep disorders. Um, if your mind is constantly, in layman's terms, ping-ponging, it's harder to shut it down and relax. There are some disorders that correlate very strongly with ADHD. They're not causal, but there's a strong relationship. You're more likely to have these disorders if you have ADHD. Oppositional defiant disorder, basically a condition in which individuals will defy authority for the sake of defying authority. Now, don't get me wrong, opposing unjust authority is a very strong characteristic that people need to do, but doing so for the sake of doing so in and of itself is purely oppositional defiance. Conduct disorder, so antisocial behaviors such as stealing, fighting, destroying property, or even harming animals. I'm not to now, most people with ADHD don't do such things. However, there's a higher likelihood if one has ADHD. Mood disorders, including difficulty, low frustration tolerance, and kind of irritability or even explosive anger, is higher with ADHD. Learning disabilities, and I strongly land on the notion that if things are taught the right way, people with ADHD certainly can learn very well. But as a whole, people with ADHD have more difficulties with reading, writing, and communicating. Again, substance use is more likely with ADHD, in particular, stimulants. Most commonly used stimulant is nicotine and then caffeine. Um, and people with ADHD are more likely to use stimulants in particular, but other substances as well. And a huge one is a huge crossover with clinical anxiety. If your mind is always racing, it's very easy to fall into a pattern of catastrophizing and being very fearful of what's to come. And ADHD type divergencies lend itself very well to that. And then OCD, which used to be categorized as a type of anxiety disorder, but it's basically unwanted thoughts and fears relating to, or that lead to rather repetitive behavioral patterns. And then mood disorders are higher, such as bipolar, ASD, and which is the other very prominent neurodivergence, and ADHD have a high correlation together as well. And then tic conditions, unwanted sounds, unwanted tics can be very common for people with ADHD. Now, there are some preventative behaviors. However, um, some of these are once you're a child or an adult with ADHD, these are certainly out of your control. In utero, using in particular smoking does have a higher correlation with ADHD. And then early childhood exposure to cigarette smoke and lead in particular has a high correlation with ADHD. And then screen time. Excessive screen time feeds into ADHD-like features. Essentially, if you're watching, let's say, a TikTok video, there's dopamine hit that come very quickly with very strong sensory stimulus, and that feeds into some of the features related to ADHD. Now, treatment. Now, to be clear, and I think this is probably a very good time to confess this, I have ADHD. I am a middle-aged individual, so I've had many, many years to learn how to manage this. Prior to treatment, I mean, you need to get diagnosed, and that usually starts with your medical doctor. And then there are available in Ontario specialists who specialize in diagnostics for ADHD. Sometimes that's covered with benefits, sometimes it's not. It's not, unfortunately, covered by OHIP for adults. In some cases, it can be covered for children. Um, and there are various ways to treat ADHD. There's two basic types of medical or medicinal intervention. Um, so basically, oftentimes individuals with ADHD will be prescribed medication. The first type is a stimulant medication. And it seems counterintuitive to prescribe a stimulant for ADHD. Um, and some sort of amphetamine type drug, most common like dexedrine, Adderall, or Vivacin would be prescribed. And what they do is they stimulate the parts of your brain that essentially are muted due to the ADHD features. And also there's methylphenidates, which is another type of a stimulant that has the same effect of turning up the parts of your brain that are muted by ADHD features. Most common forms of that are Ritalin and Concerta. And then there are short and acting forms of these stimulants. Um, some and oftentimes an individual, the dose will be played with. A problem for children if the dose is too early in the day is it suppresses appetite and can stunt growth. Um, and slow release maintains its effect throughout the day versus ones that are not slow release, more immediate release. There is a waning of the effect of the medication, and people will have more ADHD-like features as the medication wears off. Now, there are health risks associated with stimulants, including heart conditions, loss of appetite and sudden weight loss, and also mental health conditions, especially irritability or undue irritability or agitation. Additionally, there are other medications that have been used for ADHD, including antidepressants such as bupropion is most commonly used to treat ADHD. And basically, this is an off-label use. These are primary antidepressants. They have slower release, and also the stimulants will have an immediate effect on ADHD symptoms, whereas the antidepressants will have, it takes a few weeks for the medication to stay in the system and take an effect. Now, one of the problems associated with ADHD and treating with antidepressants is the, the concurrent presence of anxiety features and sometimes depressive features. When someone goes on a antidepressant to treat ADHD, the antidepressant can take away some of the lack of motivation and sometimes the task avoidance associated with ADHD. But if there is a suicidal baseline, it will take longer to act on that suicidal baseline. So there's this period of higher risk associated with antidepressants for ADHD. Long run results are much better, but there is a period of still potentially having these suicidal feelings and being stuck with them. Now, also behavioral therapy can be a good treatment for ADHD, and individuals with ADHD can learn strategies about how to manage their thoughts. This is where I kind of self-disclose a little bit as someone with ADHD. What I will often do is I will have a notepad in front of me if I'm in a meeting, for instance, and I'll do tasks on the notepad that are related to the parts of the brain that aren't used for the meeting. In other words, I'll do like long division or adding numbers to however many decimal places, because that engages in an algorithmic part of my brain while my more social part of the brain is acting. And if I feel the need to blurt out, I kind of focus a little bit more on the algorithmic part of my brain. And that kind of quells symptoms in some cases. I find finding a baseline of lots of physical activity is very helpful as well. And there's various other things that I do individually to manage it. Now, I talked about ADHD superpowers. Individuals with ADHD tend to respond well in crisis situations where rapid decisions are needed. based on relatively little information. People with ADHD tend to do well in emergency professions such as firefighters or EMS, paramedics, for instance, or anyone who's responding to in the moment um, crisis, because again, you have to make rapid decisions on relatively limited information, and there's kind of a protocol as to how you're supposed to respond. So it becomes kind of a drop-down menu in your brain. It's like, I have to do this and this and this very quickly. What is this information very quickly, and make a safe decision. There are many, many other professions that would tie to that, but simply put, I subscribe to the view that is held by many Eastern and indigenous philosophies that ADHD and neurodivergence is a gift because individuals can offer different worldviews and therefore different angles of help or angles of information to the wider population. And diversity in population, diversity in ideas, diversity in approach lends itself to a stronger general whole. And yeah, that's what I have to say about ADHD.
Thank you so much, Ernest, for this fruitful, informative presentation about an ADHD. A lot of information that actually came totally new to me. So just one question
Sure.
I have. So how we can, in general, collaborate or work to change any stereotype ideas or thoughts that that people might have about people with ADHD.
Well, in particular with ADHD, I think it has to do with just educating people about like, people can't have ADHD, and these are certain behaviors and certain traits that are not wanted. You know, when I've been struggling with being overstimulated and I blurt out and interrupt people, it's not that I want to do that. It's not that I mean any disrespect. It's that my brain works that way. Now, clearly, um, I work to not do so. But education in that regard, for instance, about certain features of ADHD are very is very valuable. However, I think the macro level picture of that is one that ties to a notion of meritocracy. Our society, kind of global Western society, um, views tends to promote the view that people are as valuable as their economic input. And that also lends itself to a narrative of meritocracy where people get what they deserve because of their value and hard work and work ethic and all these things. And I think anytime you're looking at a population that is different or relatively marginalized or extremely marginalized, you have to divorce yourself from narratives of meritocracy because there are many, many forces that impact people's lives, and many of which you can't see. ADHD is a invisible condition. Um, you don't see it right away. It's not like being in a position where one is wheelchair bound and you'd see the wheelchair or the difficulty with movement. Um, so in other words, coming into a place of viewing people not as judging them for where they are, but rather trying to understand how they got there. And I think that's true of many conditions across many points of entry. And I think ultimately that's it, is asking yourself, how did this person get here? Not
Mhm.
they're a bad person for being here. And obviously
Mhm.
that's a binary, but I think that's the key, in my
In-
opinion.
Indeed, and that also could apply almost to everything,
Yeah,
to
absolutely.
all of, mental health issues or struggles. So
It can apply to mental health, it can apply to poverty, it can apply to physical location, it can apply to a lot of
indeed.
things.
Mhm. Well, at the end of this presentation, I would like to express my great thanks to you, Ernest Johansson, for this wonderful time and knowledge. Thank you so much, sir.
You're very welcome. I'm very passionate about these issues and I'm very happy to speak on them. So thank you.
Thank you so much. So, and for everyone, as always, stay safe, stay well, and we're looking forward to see you at another session with Rights and